Welcome everybody to our bi-monthly appointment Q&A with Barbara, where you get to send your questions in and I will answer them every other Thursday. Today we have three very interesting and very diverse questions, and I'm very excited about it actually. So let's jump right into them. Our first question today is from Riley. Let's see what she's asking. A couple of hours after celery juice, or if I take too much spirulina, I get an extreme racing heart and anxiety. I don't mean to sound dramatic, but I'm sometimes scared I might die. I have PTSD from having so many bad reactions. I try to cut back on my doses, but sometimes I take too much. What can I do in the moment to alleviate my symptoms? So I didn't have a lot of background on Riley. That is why I went back and asked her a few background questions. It turns out that Riley was also diagnosed with POTS, postural orthostatic tachycardia syndrome, and that started to make a little bit more sense to me. Anthony says that POTS is due to a specific strain of EBV and the neurotoxins that come with it. So Riley, I think your body is trying to talk to you with this tachycardia after the spirulina or the heavy metal detox smoothie, and it's saying that either you're detoxifying too fast, so the toxins don't have enough time to go out, or your lymphatic system is stagnant, so the toxins are not going out. So regardless from which one it is, your toxins are staying in, because to me this is a clear sign of a heavy toxicity in the system all at once. And so my suggestion to you would be to reduce the amount of celery juice you drink. So do it just once in the morning, and then if you want to do it again, space it out and do another one in the afternoon, or maybe change juice. You can do a cucumber and ginger or cucumber and apple. That would be great as well, and also very good to flush out your lymphatic system if there is a problem. And I will stop at once the spirulina and the heavy metal detox smoothie, because as I said in the past, the body is able to handle a certain amount of toxins that are in the system. But when it's overburdened, because the heavy metal detox smoothie is a heavy chelator, so what it does, it goes and dig down, removing some of the toxins that are stored in the fat, so securely stored, so to speak, and so brings more toxins to the surface. And if your body is already struggling to eliminate all the toxins that are coming out due to killing of the virus, the byproduct of the virus, and all the rest of the toxicity that is in your system, then heavy metals and pesticides and whatnot, then the body will struggle to just take care of the new toxins brought up in the surface by the heavy metal detox smoothie. For this reason, I advise you to stop it for now. Just listen to your body. The healing journey goes through ups and downs, right? And it's very normal. Maybe this is a time where you just need to nurture yourself a little bit more. Slowing down doesn't mean reverse the process. It just means, in a sense, fast forward in the process, because when you have this reaction, your body is in overdrive and your body is overburdened, and so is your liver, and so is your lymphatic system and your kidneys. So you want to make sure that you listen to the body and you give it what it needs. So right now it doesn't need spirulina. Right now it doesn't need 2 cups of celery juice. So slow it down to really go further. That is my advice to you. Our second question is from John. That's what he's asking. From age 10 till now, age 23, I had mild autism-like symptoms in the hindsight. I was self-aware enough that I was able to mask my symptoms and function normally until my teens, when I became severely neurologically ill. I've been on the heavy metal detox smoothie for 8 months, and I've noticed a huge improvement both cognitively and socially. I'm extremely grateful for this improvement, but I've consequently developed PTSD as a result of feeling trapped in my brain, as well as being extremely embarrassed of who I used to be due to my brain not working. How can I overcome this? Medical medium protocols are helping, but I just can't seem to let this go. John, this is a very good question, especially because it enables me to talk about something that I'm very passionate about, and that is the correlation between primary food and secondary food. So on a physiological level, PTSD causes an imbalance in the brain that occurs when people experience trauma. Glucose here is the answer. Glucose is a very potent and protective biochemical that provides protection to the brain and the neurological tissues. If there isn't enough glucose storage to feed the central nervous system and protect the brain from the corrosive effect of adrenaline and cortisol that are produced when we experience fear and trauma. This could have lasting effect. So the answer on a physiological level is for you to make sure that you have a good glucose storage bin and that you don't run out of that glucose reserve. So make sure that you eat every 90 minutes, that being fruit. So any kind of fruit, but berry, melons, dates, bananas, just to make sure that your glucose reserves are always replenished. On an emotional level, instead, one of the most powerful ways to heal PTSD is to create new experiences, new positive experiences that serve as a reference point in your life. In fact, the issue with PTSD is the fact that once we have experienced the trauma, then our fear in the present and the future is that the same experience can represent itself with the same outcome. Instead, we need to rewrite the story and create new experiences, new positive experiences, so that we reframe the expectation. So one of the things that I always suggest my clients with PTSD is to pick up a few things. One is start journaling, because it is important to journal not just about how we feel, but also how we wish things were, rather than how they are or how we perceive or we are afraid they're going to be. So just create, not a fantasy world, but just create a frame for your how you would like your future to develop. And so start writing all the things that you would like without fear, without censoring. Just write how you wish your life would unfold. And that's really important, to start creating that relationship with yourself and start voicing, even though you're just writing, what you would want this outcome to be for your life. Another important part is to reach out to support. So that could be a therapist, of course, but for me, community-based healing, this is how I called it, is much more powerful. So that could be reaching out to a couple of friends, if you do have some close-knit friends, and you kind of start, voicing your feelings and have them be your mirrors, so that they can reframe certain expectations or experiences for you, because maybe the way you see them, they're not really the way they would unfold or the way they perceive them. And if you don't have a close-knit group of friends, I created a program called Soul Circle specifically with this purpose in mind, specifically to be a group where people can get together, even though virtually, from all over the world, and do 6 weeks of really mirroring each other and reframing each other's perception of reality. And this is extremely powerful. So whether you want to do it with us or finding something similar, I really feel that could be a good step forward for you. Our last question for today is about oral hygiene and comes from John Jackson. Let's see what he's asking. Dear Barbara, how can I repair tooth damage from hydrochloric acid from bulimia? John, my answer here is twofold. In one end, we have acids brought up by induced vomiting that may be damaging the enamel and the gums in your mouth, making them more prone to decay and infection. Unfortunately, there isn't a way to replace the lost enamel, but there is a way to fortify and remineralize its content. For this reason, you should look for a toothpaste that does exactly this, and it's not very abrasive. Anthony recommends Lucky toothpaste because it's very gentle, and you want to make sure that it doesn't have any corrosive agents, because as we said, your teeth may be already very sensitive from the acids in your mouth. The second part of my answer is about the fact that self-induced vomiting, as you know, doesn't just damage your mouth, your teeth and gums, but also damages your digestive tract. In fact, I often find that in patients, bulimic patients, that due to the acids brought up by induced vomiting, then they have an imbalanced, acid composition in their stomach. For this reason, they have a hard time digesting food, and the food that is not properly digested stays in the stomach and putrefies. So Anthony tells us that when the stomach putrefies, they start producing ammonia and other type of acids that were not meant to be there. And during the night, they travel through the esophagus all the way to the mouth, contributing to the possible decay and infection in your mouth. So for this reason, I will encourage you to add to your diet, if you're not already doing this, lots of food that are ammonia fighting food, like celery juice, of course. Also aloe is really powerful, apples, papaya, bananas. As far as supplements, I would say add some vitamin C, a good source of vitamin C, CoQ10, licorice root, pulsating, 2 weeks on, 2 weeks off, as well as probiotic for your flora, and peppermint tea. That's also very soothing. As far as lifestyle, I would say drink more water, especially if you have low salivation level, and to just make sure that you're, it's very well hydrated and there's no possibility for bacteria and an infection to take place. But drink your lemon with a straw, and use possibly an electric toothbrush and an electric hydrofloss irrigator. So this is all for today. I will see you again in 2 Thursday from today. And yes, please don't forget to send me your questions at questions@ahealthyinprogress.us. Thank you.